Evening, everybody, and welcome to this evening's Applying Health Coaching Principles when Communicating with Patients at Risk of Chronic Disease. My name is Samantha, and I am your host for this evening. Before we start, I would like to make an acknowledgement of country. We recognise the traditional custodians of the land and sea on which we live and work, and we pay our respects to elders past and present. So I'd like to introduce our presenters for this evening, Dr. Jeannie Yu and Sarah Coe. Jeannie is a Sydney-based GP and Clinical Director of Remedy Healthcare, a national provider of health coaching and in-home health services. Jeannie has a background in medical education and quality improvement, digital innovation and medical ethics. She graduated from the University of Sydney and has practiced in Sydney and Melbourne. Thank you for joining us, Jeannie.
A pleasure.
And we also have Sarah. Sarah is the Senior Project Officer for the Get Healthy service at the New South Wales Office of Preventative Health. She has an honours in nutrition and dietetics, Bachelor of Exercise and Sports Science, Cert 4 in Training and Assessment, and is a qualified health coach. Her experience spans across public health, food industry, research and private practice, but her special interest lies in coaching and behaviour change. Sarah currently supports the statewide expansion of the Get Healthy service into new clinical fields, which we'll be hearing more about later. So thank you, Sarah, for joining us.
Thank you.
Wonderful. I will hand over to Jeannie now to take us through the learning outcomes for this evening, and we will then proceed with the rest of the presentation.
Thanks very much, Sammy. Tonight we've got a series of learning outcomes, as you can see on the screen. We're aiming to increase our GP participants' awareness of where health coaching fits in the continuum of care, to identify the most appropriate stages when a GP can refer a patient for health coaching, discuss the benefits of health coaching in improving a patient's health, and to describe how to refer patients to existing New South Wales health services, such as the Get Healthy service.
So I'm sure everybody online is very aware that Australia has unacceptably high rates of risk factors for chronic disease. As a population, we're sitting more and moving less. Our diets are becoming increasingly energy dense but nutrient poor, and these are to the rising rates of obesity and preventable diseases like diabetes, cardiovascular diseases, and certain cancers within our population. So while there are many factors that contribute to chronic disease, some of which are beyond our control, like our family history, our culture, our age, the one we'd really like to focus on today is the unhealthy behaviours. We know that for our patients, this is one of the most common risk factors, and it is a main cause of chronic disease. However, it's also something that as GPs we can influence and help change. And I think the important thing to note here is that small changes make a really big difference. So we know that for every kilogram of weight loss, the risk of developing type 2 diabetes reduces by 16%. And for people with pre-diabetes, losing just 5 or 10% of their body weight can actually prevent that progression onto diabetes in 6 out of 10 people.
Thanks very much, Sarah. So changing behaviour is important, but we also know that it's complex and there are a range of barriers to that. So we'd like to invite our GPs tonight to send in their responses about which barriers their patients most commonly cite as a reason why they can't change various lifestyle behaviours. Thanks very much, Sammy. So in the meantime, while we're waiting for those results to come in, Sarah, would you be able to explain how health coaching can support patients to overcome barriers to changing their lifestyle?
Thanks, Jeannie. It's a really good question, and I think one of the common misconceptions when it comes to working with a health coach is that the health coach is actually going to solve those barriers for the patient, but that's not actually what happens. So part of coaching is recognising that the person themselves are the expert in their own world, and it's really important that they come up with the solutions to their barriers. And by doing so, often that gives them that sense of ownership, and they're much more likely to then actually implement those strategies as well. So an example I like to give here is I know in the past I worked with someone who really struggled to eat regularly throughout the day. And her biggest barrier was remembering to do so, because she was just so busy at work that she wasn't having regular meals. She'd get to the end of the day with all intention to choose healthy options, but was just ravenous and would then grab anything and everything. And so we talked about how she could overcome this barrier. And I think automatically, as health professionals, we can think of a number of different solutions that she could be trying. But following that coaching principle, rather than giving her options, we asked, well, what could you do instead to remind yourself to eat more regularly? And she actually came up with the idea that because she works at a computer, she would actually change the password of her computer to be mindful. And that was her prompt, so that every time she got up and left the computer and came back, she had to type that in, and it reminded her of her goals and to really be mindful to eat more regularly throughout the day. And that was, I think, a really unique solution that as health professionals we wouldn't be able to come up with, and it's really important and highlights the importance of giving participants or patients that ownership of their goals. And working with a coach can really help to normalise that these barriers are all a part of that change process.
So that's a great example, Sarah, and one which really illustrates the fact that the participant is an expert, and that solutions that they come up with are likely to be the most effective, rather than ones that we as health professionals think would be a good idea. So certainly time, being stressed and being unsuccessful in the past, along with COSTA, are all common barriers that our patients provide or bring up as reasons why they are unable to change their behaviours. So I want to then move to sort of the next aspect of health coaching, which is that as we know as GPs, information in itself is important, but on its own is not effective in encouraging positive behaviour change. So Sarah, what are some of the other important elements when we're thinking about whether someone is ready to engage in a health coaching process?
Thanks, Jeannie. It's a really good question, and I think information is definitely key, but as health professionals and GPs, as you would know, it's not the only element that's important for behaviour change. So I'd like to introduce a principle that you may or may not be familiar with that's called RIC, and this is a coaching principle that stands for readiness, importance, confidence, and knowledge. And it follows the concept that for someone to be able to effectively change their behaviour, as health professionals, it's important that we gauge where they're at in these 4 domains. So firstly, they might know what they need to do, but right now, are they actually ready to make changes? Have they got so much going on in their life that they're not able to prioritise, let's say, eating more healthily at the moment? So how ready they are. The second is the importance, and this is really linked to, I guess, how much they value their health and where their motivations are. So, for example, you might have someone who, let's say, is about to start a new medication for diabetes, but tells you that, you know, their mum has had diabetes for their whole life and it hasn't affected them at all, so it's really not an issue and they're not concerned. And so by discussing the level of importance, it gives you a little bit of an indication in terms of whether or not they value or understand the impact that lifestyle change might have on their health and health risk. The next being confidence. So I think somebody's belief in themselves to be able to change definitely has an influence on their ability to then succeed in that change. So if you hear someone say, oh, I'll never be able to lose weight, or I've tried 100 times in the past and I always fail, that kind of language really indicates that low confidence, and it's something that we can work with to help them be more confident, set more appropriate and realistic goals. And then finally, knowledge. So as GPs, you're a very good source of evidence-based information for your patients that you see, and it's important that they understand, I guess, why or what they need to do to be able to address those health risks.
So thanks very much, Sarah. I think that's really a great way to remember that it's not just what you know, but all of those other elements that's important. They're important ingredients in behaviour change. We've had a question come in which is saying that what patients need is the real will to change. So I think that it might be helpful to go through the model of the stages of change that we as GPs have certainly heard of, and which is a really underpinning principle behind health coaching.
Yeah, sure. And I guess leading on from what we've just talked about, that RIC scale can really give you a little bit of an indication to where someone is in terms of the stages of change. So just to briefly refresh everyone, there are the 5 stages of change. So pre-contemplation, where someone's not even thinking about change. Contemplation, where on one hand they can see the benefits of, say, getting a little bit more active, but on the other hand there's all these other things that are stopping them from actually starting right now. Preparation, where they might be actively taking steps to start but haven't started yet. So for example, they could have joined the gym, they might be starting to plan their meals for the week. Action, where they're actively implementing some strategies to work towards that goal. And maintenance, where they've been able to maintain that change for a little while. They've been able to overcome some of those barriers and really build up that confidence to keep going.
And so perhaps one of the major helpful aspects of this model is that we can think about where patients are up to in the stages of change, and also to be realistic about where we're trying to move them to. So I understand from a health coaching perspective, you're not expecting to go from the very beginning to the very end right in one go. You're actually trying to move a patient to the next stage of change.
That's exactly right, Jeannie. So for somebody who's contemplative, so thinking about getting more active, you're not going to get them to start walking tomorrow. But what you would be wanting to do is helping them move to that next stage, which is preparation. So getting them thinking about, well, what would be the benefits if you did start, and what would be the things you would need to do if you decided to start. And that's true for all of the stages. Your goal is to move to that next stage of change.
So relapse is also an important feature of the model, and of course that's an almost universal experience for anyone who's trying to change an ingrained behaviour. When can relapse occur, and how does health coaching support patients when they do relapse?
Yeah, that's a really good question. So I think it's important to note that relapse can occur at any of the stages of change and can cause somebody to jump back into any stage of change. So if you do hear that your patient has relapsed, it's important to reassess where they are again, because it's not an assumption that they've automatically got back to where they left off. And where coaching can really support is to help normalize that relapse is a part of that change cycle. And it really is learning from those previous experiences, what happened, what got them off track, and what they can do to get back on track. So it's like, for example, getting the person to think about developing this new habit, like the skill of riding a bike. So just because you've fallen off doesn't mean that you've failed. And if you think that way, you probably won't ever get back on that bike again. But it's recognizing, well, what happened, what got in the way, and how can we overcome that in future?
Well, thanks very much for that, Sarah. I think we might go on then to talk about what health coaching is overall. And so in summary, it is a practice in which trained health professionals apply evidence-based principles and techniques informed by health psychology and coaching psychology to assist their patients to achieve positive health and lifestyle outcomes through attitude and behaviour change. Where does health coaching fit overall in the continuum of care for a patient?
So I think where health coaching fits in best is really supporting patients to implement the changes that they're wanting to see with their lifestyle. So if you think about it, GPs provide really valuable advice to their patients. They see their patients and follow up, but they might not have the time or the capacity to really help patients to come up with the specific goals, to explore motivators, and to really make those changes. And so where coaching can really come in is to complement the care that GPs offer by supporting patients to really understand why these changes are important to them and what their real motivators are, set specific goals, identify barriers, come up with their own solutions, and really give patients that accountability so that in between their GP appointments, they're able to make progress in these lifestyle areas that can really have an impact on clinical outcomes.
So health coaching really is very much a complement to the work that GPs are trying to do with their patients.
Absolutely.
Okay, so let's go on. So in terms of the elements that you've referred to so far, so health coaches help their patients or clients set realistic and long-term goals, identify key motivators, help their clients or patients decide on a SMART goal and practical action steps, identify likely barriers, decide on effective solutions in collaboration with their patient, assess their confidence and set a plan for follow-up. So we might go on to have a look at how this works in practice through a case study. Okay, so this case study is of a 48-year-old woman who has obesity. In her past medical history, she has been noted to have impaired fasting glucose, hypercholesterolemia, and suffers from depression and anxiety, for which she's on an SSRI. She's someone with a lot of demands in her life, so she has 3 children, a full-time office job. She needs to travel 2 hours a day and has a lot of financial pressures. And her GP has noted that her height is 161 centimetres, weight 85 kilos, makes her BMI 32.8, so in the obesity range, and she has a waist circumference of 106 centimetres. And she confesses that she's had multiple unsuccessful attempts at losing weight, and particularly at maintaining her weight loss. She agrees that her current lifestyle could be better. She has sort of no structured exercise and limited incidental activity, and she would like to improve her diet and to lose weight. So from a GP perspective, this is certainly a patient that would need to lose a significant amount of weight, and losing weight is essential for reducing her risk of diabetes and her overall cardiovascular risk. She sounds like someone who we should be referring for health coaching, but what else would you want to know before deciding whether to refer this patient at this particular point in time?
Yeah, so I think thinking back to that RIC principle that we introduced is a really good point. So speaking to her about some of those 4 domains, like, is she ready to change? Does she feel like, for example, weight loss is something that's important to her at this point in time, given the demands that she has with her job, her kids and such? Does she feel confident that she would be able to lose weight if she wanted to work towards that? And often opening the conversation using some of those domains from RIC can be a really good leading question to how coaching can actually support her, and is a nice way to set up that conversation for a referral.
So in this case, the patient is referred, and we're now going to go through a role play of how a coaching interaction might sound. So we have Carly here with us, who's one of our senior health coaches. So Sarah and Carly.
Thank you. So we're going to do a bit of a role play of what a coaching call on the Get Healthy service would sound like, which we'll talk about a little bit more. Carly's going to play the role of my patient for the case history that Jeannie's just gone through, and I'm going to play the role of the health coach in this instance. So Carly, you've told me that you've been referred to the service to lose 20 kilos that your GP's advised you to do to really help with your health at the moment.
Yeah.
Tell me how confident you're feeling that you can actually achieve that.
Oh, not confident at all, if I'm honest. I actually left that appointment feeling a little bit flat. I don't even know where to start.
And it is really normal. It can feel very overwhelming when you think about having to lose that amount of weight. Sometimes setting a goal that's, I guess, slightly smaller and that you feel is a little bit more realistic can be a good place to start.
Yeah.
And we can always progress that goal as you make some progress. How does that sound to you?
Yeah, that actually sounds a lot more achievable.
So I guess, Carly, if you think about a small goal that you'd like to begin with, something that would be more achievable for you, have you got something in mind?
Do you think 5 kilos could be a place to start?
Yeah, I think that's a really good idea. Sometimes breaking it down a little bit can be helpful.
Okay.
And I guess weight is the result of the actions and changes within our lifestyle. So if you think about maybe not over focusing on the weight, but how your lifestyle is at the moment, is there something that you'd like to see be different?
I think, well, right now I don't think I really have the time to exercise, so I think definitely my eating could do with some improving. I know I probably just eat too much over the day, really, particularly at dinner time.
Yeah, and is that something that's important for you to work on right now to improve? You mentioned particularly your eating.
Yeah, definitely.
And tell me why that's important to you.
Well, I know, when I've eaten healthily in the past and I've lost weight, I've been a lot more energetic. So I think if I were to lose weight, if I were to eat healthier, I would be able to keep up with my kids. I'd probably be feeling a bit more energetic at work, be a little bit more productive, and also feel a bit more confident in myself as well.
And what would that mean for you if you had more of that confidence and more of that energy?
Oh, it would mean I'd be a better mum, a better worker. It would mean a lot.
Okay, so it does sound like this is something that's really important to you. If you like, perhaps, I know you've mentioned there were a few areas you wanted to work on with both your exercise and your food, but perhaps we can maybe choose one area to begin with and just make some small changes there. I can really hear that it's important for you to set those examples for the long term, and I really don't want you to feel overwhelmed with changing too much at once. So is it that dinner meal in the evening that you're wanting to work on, or is there a different priority that you'd like to start with?
No, I definitely think the dinner meal would be a good place to start, and something that's a bit easier for me to start with as well. I don't have much time really.
Okay, so tell me a little bit about what's happening for you with dinner at the moment.
Well, to be honest, my meals are really healthy. I know how to eat healthy. I've done Weight Watchers. I've done it all. It's just that I eat too much. So my husband serves me up my dinner, and he just puts too much on my plate. So I think that's the main issue there.
Okay, so it sounds like it's the portion sizes that you're wanting to address, is that right?
Yeah, so I know that, I follow the guidelines. I have lots of veggies. I have that lean protein. I get, brown rice and things like that, but I'm just really eating too much of it.
Okay, so tell me, what is it that you have in mind that you'd like to see change with your portion sizes?
I reckon maybe if I just cut it back by half, or maybe just not have the carbs on my plate.
Okay, and is that something you've tried in the past?
Yes.
Tell me a little bit about how that's gone for you.
Oh, it's terrible. I was so hungry.
And look, sometimes when we do make big changes like that, it can be really hard to sustain. Can I give you a little bit of a suggestion?
Yes, please.
There is a bit of a rule that says if you reduce your portions by about, say, 10 or 20%, it's just enough for us to notice a little bit of a difference and to help with that weight loss, but not too much of a difference that leaves you feeling hungry and looking for something else later in that evening, for instance. And it also means that you're not then cutting out like a whole food group like the carbohydrates, which still provides really valuable nutrients.
Yeah.
What do you think about that, Carly?
Okay, that sounds a bit more achievable, I think.
Okay, and is that something you feel like you'd like to try to do?
Yeah, I think so.
So if you were to reduce your portion sizes at dinner, what steps would you need to put in place to be able to actually do that?
I think I'll definitely need to have a good chat with my husband to tell him to stop putting so much food on my plate. I think that would be the first thing to do.
Okay, and when would you like to have that conversation?
I can do that today.
Okay, great. Is there anything else you would need to do?
I think another part of the problem is actually I'm always going back for seconds.
Okay.
So I think what I need to do is actually either not have leftovers or just pop them in the fridge straight after I portion them out. So that way I'm not tempted.
That's a great idea. And how might you remind yourself to do that?
Well, I actually have a picture of the portion plate. I can actually just stick that on the fridge, and that can remind both my husband and me that that's sort of what I'm aiming for. That's
fabulous. So, Carly, can you think of anything that might actually get in the way or that might stop you from being able to do that?
I think I'm just a bit worried that I might still feel hungry. I'm so used to eating these larger portions at night.
Yeah, and look, that is really common, and it's good that you're acknowledging that. In terms of hunger, are you aware how long it normally takes, I guess, for your brain to register that feeling of satiety or feeling full?
No, I didn't realise.
So it normally takes about, say, 20 minutes. And so sometimes what can happen is if we eat very quickly, we might still think that we're full, but we actually haven't given ourselves the chance to really register. And so often taking that time to eat a little bit more mindfully or slowing it down can actually really give your body that little bit of an opportunity to be more in tune and really understand whether or not you still are hungry before you decide if you'd like to have more seconds.
That makes a lot of sense.
What are your thoughts on that, Carly?
Yeah, I can try that out.
Okay. And so in terms of speaking to your husband, popping up that reminder and putting in place some of these strategies, how confident do you feel that you'd be able to do that?
I'm actually feeling pretty confident after this chat. I'd say maybe a 9 out of 10.
That's really confident. So how would it work with you if perhaps I gave you a call back in, say, another 2 weeks' time, and we can follow up with how you're going with your portion sizes and then reassess and take the next steps from there?
Yeah, that sounds great.
Perfect.
Thank you so much, Sarah and Carly. And look, I'm sure my GP colleagues would agree that there's nothing like listening to an actual coaching interaction to understand how that works. And some of the things that really strike me is the kind of detail that the coach goes into with the patient and the way that the solutions are, the goals and the solutions are patient-led. So when the patient doesn't know what to do, I mean, there's guidance and suggestions from the coach, but it is really very much a patient-led process. And very few of us GPs would have the time, or let's say the patience, to be able to go into that level of detail, and yet that level of detail is what's needed in order to support significant behaviour change.
Yeah.
So, look, what we might do is we'll go to the second half of the case study, and after that we might respond to some of the questions that have come through. So I think that some of our GPs are certainly finding the strategies that are being illustrated here, strategies that they would like to implement in their own practices. But before we get to that, let's finish the other half of the case study. So when Carly comes back for her next call, she reports that she's had some success with reducing portions with all of those sort of detailed strategy that she developed with Sarah, and she's actually lost 1.2 kilos. However, she is still a bit disheartened. I mean, she left the last call with a confidence of 9 out of 10, but she has found it a struggle to overcome a pattern of emotional eating. She's tried to address this with a little success in the past, so she has got that insight that this is an issue for her, and she has identified that stress is what her trigger is to eat emotionally. And she gets on well with her GP, but she feels a bit embarrassed and she doesn't really want to discuss her stress with her GP, but it is something that she'd like to speak to her health coach about. So let's return to the role play.
Sure. So we're just going to pick off following up from that next coaching call. So Carly, when we last spoke, we set a bit of a plan to reduce your portion sizes, particularly for your dinner meal. Tell me, how did you go with that?
Oh, I went so good. My husband was really supportive, and I've actually already lost 1.2 kilos.
That's fantastic, and it's great to see that you've had that progress at such an early stage. Have you noticed any differences in terms of how you're feeling overall?
Yeah, like I do feel good. I am very, I guess, impressed that I've been able to make that change. But at the same time, I know I can still be doing better. I'm still binge eating, which I feel really, I guess, a bit disheartened that that's still going on for me.
Okay. So firstly, I'd just like to say that it is really great to see that you've recognised the success and the progress that you've made in just 2 weeks since we last spoke. That's a really positive thing. But I can still hear that there are areas that you'd like to work on, particularly you mentioned that binge eating. So is that something you'd like for us to discuss a little bit more today?
Yeah, I actually think I'm ready to be talking about that a bit more.
Okay, and I'm more than happy to support you with that. It's something that is really common that people do experience and it's often that we find ourselves eating for reasons not necessarily linked to hunger. If you take a moment to reflect on, I guess, what might be the triggers that might cause you to overeat or to binge eat, what do you feel like those are for you, Carly?
Oh, it's definitely stress. Work's been so stressful lately. I even sort of look forward to coming home and having that time to, have my chocolate and my cakes and things like that. So it's definitely stress related.
And tell me, how are you managing your stress at the moment?
Oh, terribly. Not at all.
Okay, and so I guess it's really important, if we understand that it is stress, that we have strategies in place to support us and good networks as well to support us, so that we're not allowing it to have too much of an impact on our life. Tell me, if you were wanting to get extra support, where would you go to get some extra support for your stress, Carly?
Well, it's not something I brought up with my doctor just yet. I did go to my manager actually the other day and spoke a little bit about it. I haven't done anything so far.
Okay, and is it something you would feel comfortable speaking to your doctor about?
No, I don't think I could. I normally go to the doctor and we talk about my health, or usually my weight is a common topic, but I don't know, I've never felt comfortable talking about the stress.
Okay, and you mentioned you also spoke to your manager about it at work. Tell me a bit about that.
So I brought it up the other day, and she actually did mention a counselling program we have at work, and actually I haven't really thought too much about it until this conversation. Yeah.
Sure, and a lot of workplaces often offer programs like the employee assistance program that can link you in with a psychologist or a counsellor, and often that can be helpful, particularly if you're dealing with work-related stress. Is that something that you would be open to explore further, Carly?
Yeah, actually, I think I actually will. I think it's gotten to that point where I've realised that I need to do something about my stress levels.
Okay, well, perhaps if you like, I can follow up with you on our next call to see how that's gone.
Yeah, that sounds good.
Okay, and so going back to what you mentioned about that binge eating, we can definitely talk about some different strategies to support you to manage that in the past, moving forward. Tell me, has there been anything that you've done in the past to try and address that?
Yeah, I've very unsuccessfully told myself that I won't eat that chocolate, but I still do. So have not been very successful with it.
And it's a really common thing, and it's a really challenging thing. And you mentioned before that you really look forward to it. And it's one of those things where food not only nourishes us, but it brings us a lot of joy. And that's not a bad thing. But I guess it's when we're over-consuming that we realise the impacts that then has on other areas of our life and our health. So perhaps if you like, I can share with you some different strategies that you might find might work for you to help address this.
Yes, please. Yeah.
So there's an approach that's called the 4Ds. Have you heard of that before?
No, I can't say I have.
Have you got a pen and paper with you, Carly?
Yeah, I do.
Okay, so I'll talk you through it, and perhaps you can see if this is something that might work for you in your life. So the 4Ds is an acronym, and it stands for delay, distract, deep breathing or drinking water, and the last one's a little bit funny, it's decatastrophize. So I'll explain to you what that means. So the first one is delay, and that means it's the concept of taking some time. So if you feel like you have a craving and you know that it's not related to hunger, sometimes those cravings can feel like the urge is very strong, but it also tends to wax and wane, and it can often fade away. So taking that time to delay it and ask yourself, or maybe to give yourself that 15 or 20 minutes to see if you still really would like that treat, or if you would like to consider how much you would want if you actually still felt like it, is a nice strategy to just allow you to think about that food or that situation a little bit more mindfully. The second one being distract. So you mentioned that often it's stress, and food is that enjoyment and that relief at the end of the day that can help bring you that joy from a stressful work day. So it's thinking about, well, what else could you do to distract yourself, but to also bring you that, I guess, stress relief that you're looking for. So if there's anything else that you could do in your time that would be enjoyable, things that you might not normally have the time or think to do. The third being deep breathing or drinking water, and that's around bringing some mindfulness to your body and taking some deep breaths, recognizing and challenging whether it's true hunger or whether it's a craving at that time.
Yeah.
And then finally, decatastrophize, and that's really acknowledging the fact that change is hard. And, you know, often we might have the right intentions and we might have all these strategies and it might work some of the time, and other times things might be too stressful and it might not go the way you've planned, but that's okay. And it's recognizing that this is a normal part of the change process. And if you do find yourself slipping up, not to be too hard on yourself. You haven't failed, and it's about focusing on what you could do next time to really overcome some of those challenges you might have experienced.
Okay.
Do any of those strategies resonate with you? Is there anything that you feel might work?
I like all of them, but I think particularly the distract one. So there's definitely so much other things I could be doing at night time instead of eating. So I actually think what I need to do is come up with a list of what these things could be. So that way I can go to that instead of going to food.
Okay, and just thinking about it now, is there anything that's coming to mind that you might do instead that could bring you that joy or that stress relief?
So definitely, well, firstly, just doing something with the kids. There's a game that they like to play and I can get involved with that. Or even having like a bubble bath or something. I never take that time to myself
For
to
yourself.
relax. Yeah, so I'm sure there's other things I can add to the list, but they're just a couple that I can think of now.
That's fantastic that you've already got those ideas, and it sounds like they're definitely things that would help to relieve some of that stress and bring joy to your day.
Yeah.
And look, it is hard if you're used to that routine of coming back and having something unhealthy or using food as that's a source of joy. It is hard to sometimes remember these other strategies. Is there anything that you could be doing to remind or prompt yourself?
Actually don't know. Do you have any ideas?
Yeah, I can definitely give you some different strategies that have worked for other people.
Yeah.
So sometimes people find that because it is a little bit of a change in routine, doing things that will almost prompt you or remind you of your plans can be really helpful. So for example, if it is a game that you're wanting to play with your kids, taking that out and putting it somewhere in your sight so that you can see it. Or even telling the kids or your family that that's the plan so that you've got that support around you to remind you, and I'm sure the kids would remind you.
Yeah.
Similarly with having a bath, you know, it's looking at, well, do you have the things ready that you would need? Is your bath ready for you to use? And can you leave things out that are going to remind you that that's the plan that you've set for yourself for that day?
It's actually a really good idea. I'm going to go home and set that stuff out.
Okay, and so in terms of your confidence in being able to put some of these plans in place, Carly, where do you think you're at the moment?
I'm feeling so much more confident. Maybe not a 9, I'll say 7 out of 10.
Okay, and can you see anything getting in the way for you?
I think it's just more so doing it. It's such a strong habit for me, doing the binge eating. So I think just getting started is the first step.
And you're absolutely right. You know, it's not something that we can expect will change overnight, particularly if it's a habit that we've had for a very long time. And sometimes it's even, you know, recognizing if you're finding that you're binge eating, say, 7 days a week, that even if it's reduced to, 4 days a week, that's still 3 days less than what you would have been doing for the past, months or years. And so it's recognizing that small steps make a really big difference.
Okay. I'll keep that in mind.
Perfect. So we might stop the case there.
Thank you so much, Sarah and Carly. I think that all of us as GPs are very familiar with the challenge of emotional eating. And I think most of us will have heard of the 4 Ds: delay, distract, deep breathe or drink water, and decatastrophize. But I think what your role play illustrates is how to apply that in practice. How to encourage the patient to come up with examples of what speaks to them and what that might look like, how to help the patient remind themselves of what they're intending to do, to think about what the barriers could be, and then to find a strategy to deal with those barriers, and then lastly to be realistic about what can be achieved.
Absolutely.
So that's really great to see that sort of fully exemplified. So thank you for that. Just before we leave the case and we move to talking about the Get Healthy service and also to addressing our questions, I did want to ask you, Sarah, in this particular case, this is a patient who has a background of depression and anxiety, and the health coach has just started to explore her experience of stress and how that might be affecting her.
Yeah.
When would you feel that a patient like this actually needs to be reviewed by their GP? When would you send them back for medical review?
Yeah, that's a really good question. So one of the things with the service is that the coach often works with the same person throughout the coaching journey, and so they really get to build that rapport and understand. But it also means that they can pick up changes in terms of where they're at, both with their physical as well as mental health. And anytime there's a red flag or an indication, the coach is really clear in staying within their scope of practice, and they would often encourage the person to go back to their GP and to have that discussion.
So that's great to know. So it really is a continuum of care, and it really is a team-based approach.
Absolutely.
With coaching complementary to what GPs are advising, and also coaches sending the patient back for review when they detect that that's what's needed.
Yeah, absolutely.
So let's get on to the New South Wales Get Healthy service. So can you tell us a little bit more about that, Sarah?
Absolutely. So the New South Wales Get Healthy service is a program that's offered by New South Wales Health to all residents over 16 years of age. It's completely free of charge, and it provides patients access to their own health coach, who are generally university qualified dietitians and exercise physiologists, and they receive up to 10 coaching calls over a 6-month period. And as I mentioned, it's usually the same coach that works with them, and the coaches schedule in calls like appointments so that they can follow up with the participants and really help them work towards their personal goals. The service is open from Monday to Friday from 8 a.m. to 8 p.m. So it really does accommodate for people's work schedules, people who might be wanting a call, say, in the evening or during their lunch break, that kind of thing. We've been running for just over 10 years, and in that time we've had more than 104,000 people referred to the service, over 2 million visits to the Get Healthy service website. And on average, we're seeing weight loss of about 2.8 kilograms and 4.1 centimetre reduction in waist circumference. We're also really importantly seeing changes in terms of key outcome behaviours that really affect those lifestyle risk factors we've spoken about. So the change from baseline when they join the service to when they've completed the program of people who have achieved adequate fruit intake has gone from 50% to 74%. Those consuming the 5 serves of vegetables has gone from 12 to 32%. And people undertaking sufficient physical activity has increased from 39 to 62%. So we're really seeing those improvements there. If you did have any patients of yours that you were wanting to refer to the service, there's a couple different ways that you can do that. We've recently launched a new online referral form on the website, which allows you to actually save your referral details to the computer or the device so that you're just entering patient details, and that gets sent directly to the Get Healthy service, and a coach then calls your patient within the next 3 business days. You can also access referral forms on medical director as well as best practice, and that can then be emailed or faxed across to the program. And referrals can be made by anyone, so it could be the GP, could be a practice nurse, or if you've got other health professionals or allied health within your clinic, they can also refer. If you did have someone who is, I guess, a little bit more contemplative and not ready for a referral right now and just wanted to think about it, patients can also self-register themselves when they're ready by calling the program or going online and registering their details. There's also the option to receive feedback letters on how your participants progressing throughout the program, and that's as long as you tick for that request and that the person consents for you to receive those updates as well.
So we've had a couple of questions come through about the Get Healthy service. Is it only for New South Wales residents?
Yeah, so it's a good question. At the moment, there are 3 states that are funding the program. So that's New South Wales, Queensland and South Australia. So it's open to all residents across those 3 states.
So currently the ACT is not included in the service?
No, unfortunately, we don't have the service available in the ACT.
And are there eligibility criteria for Get Healthy referrals?
Yeah, so we're really open in terms of the service. We have a few different tailored programs that can support specific needs. So we have a type 2 diabetes prevention program, a general one around healthy lifestyles. We have one that supports healthy weight gain in pregnancy. So you can refer for specific reasons or goals, but the only criteria is that they are a resident in New South Wales, South Australia and Queensland and are over 16 years of age.
Okay.
So just a final note on some of the other programs that are also available in New South Wales, which might be helpful as well. And I'm really mindful I am focusing specifically on New South Wales just because that is where I work as part of New South Wales Health. But we've got the Healthy Kids for Professionals as well, which is a website that offers free resources really developed for GPs and health professionals to help assess and manage children who are above a healthy weight. And it's got some really good resources there as well for starting that conversation, which can sometimes be a challenging and sensitive topic to raise. They've also had other RACGP webinars in the past that they've presented on, and there's videos available there. We've got Go for Fun, which is a 10-week program for New South Wales children aged 7 to 13 years who are above a healthy weight, and that really focuses on making healthy lifestyle changes as a family to encourage healthy eating habits, more physical activity and addressing self-esteem in kids. And we also have the Aboriginal Knockout Health Challenge, which is a community-led lifestyle and weight loss challenge for Aboriginal communities across New South Wales.
Thanks very much, Sarah. It's great to hear about the other kinds of programs and resources that are available. We've only got a few minutes left, but we've had a few questions come through which relate to the case study and what it illustrates. So we might go to that.
Sure.
We've had a question earlier on which is really about skills in motivational interviewing. So what aspects of motivational interviewing do you think were illustrated by the role play that you and Carly just gave us?
Yeah, so I think there are a lot of different aspects of it, and health coaching really combines a number of the skills from motivational interviewing as well as cognitive behavioural therapy. But at the core of it, it's recognising that the person themselves are the experts in their life, and it really helps to guide the person to come up with their own strategies, identify their own motivators, and really it's the coach that's doing the work to support the patient or the participant with where they're at in their own life and health journey. So helping them to really consider what's realistic, what's worked in the past, what's important for right now and what they're ready to do, and where their confidence is at to be able to make those changes.
And so those principles are something that we can use ourselves within a GP consultation where we have a more time-limited setting, but they're still relevant. Yes?
Absolutely. Those principles are really relevant, and it's all the principles and skills which I'm sure GPs are already using with, say, displaying empathy or reflecting when somebody's feeling like they're going through a challenging time or is not having much success, in this example with the case study around weight loss and such. So these skills are all skills that not only health coaches can use, but all health professionals.
And so the principle is that the participant themselves is the expert in their own life, but what do you say if the person responds with, I don't know, when you ask them how they might overcome a barrier or an obstacle?
Yeah, and it's a common one. So Often it's around if they really can't come up with something themselves, the coaches will then provide what we call a menu of options. And I guess you saw a little bit of that display with the 4Ds example. So when Carly wasn't able to come up with a solution for how she might address emotional eating, what the coach will then do is offer a menu of different options. So here are all the different things that you could do or you could try to address this challenge that you're experiencing, and then asking and reflecting it back to the person to say, would any of these work for you, or can you think of anything else that might work for you? So at the end of the day, that decision on which of those strategies they might pick is still in the hands of the patient.
And so with the 4D strategies, one of our participants has asked whether this is useful for other behaviour change areas such as smoking cessation or alcohol use disorder.
Yeah, I know that this has definitely been used in those areas as well.
And in fact, the stages of change model was originally developed in the context of smoking.
That's exactly right.
Right, okay. And then we've had a question here. When someone's at the pre-contemplate stage and you're trying to move them to the contemplate stage and contemplation stage, and then, of course, to move further along, what sort of strategies do you use to try to move things along in that situation?
That's a great question, and I think that's probably one of the really challenging ones that as health professionals we might find frustrating and difficult to support someone who doesn't see it as an issue at all. So really it's understanding where that person's knowledge is at and importance is at. They're the two key, RIC principles that are really important to focus on for someone that's pre-contemplative, because it's very likely that they don't understand the link between, let's say, healthy eating, physical activity or weight loss, what link that has with diabetes, and they don't then see the link that diabetes might have on their health, not just in the short term, but in the long term, and what impact that might then have for them. And it's really important to understand what the motivators are or what's important to that person, because all of our motivators as individuals are different. For someone, it might be, in Carly's instance, being there for her kids, setting that good example and being a good role model. That's what's driving them. For other people, it might be that they want to lose enough weight to be able to cut their own toenails or to be able to live independently in their own home, or, it's identifying for them what is it that will drive them, what's important enough for them to actually do something different, because change is hard. Once you know those motivators, you can then help link in that gap in understanding between how them doing something with their lifestyle now will affect their health risk, which will affect what's really important to them at the core.
And so that's a very individual thing.
Yeah.
What it is that's really important to you and what it is that would give you that motivation.
Absolutely. And that's why it's important to take the time to recognize it's really listening to that person and asking and finding out what it is for that person that you're speaking to. And that's once again an example of how you would recognize the patient or the person as the expert in their own lives.
And so when people say, for example, that they don't have any willpower to make lifestyle changes, what's the health coaching kind of strategy to respond to that kind of statement?
Good question. So I'd break that down into two parts. Often if someone's saying, I just don't have the willpower to change, to me that sounds like they might not be ready to change. So firstly, be addressing if they are ready or if it is something that's important to them. And if it is, and they are wanting to change, but they really feel like they struggle to have that willpower or to stay motivated, often what can be really helpful is one of two things. So firstly, explaining that motivation isn't something that you either have or you don't have. It's something that fluctuates. So sometimes, after a conversation with their coach or their GP, they might feel extremely motivated, but then after a day or two, when they've walked past the cake shop or when their favorite, movie is on TV, it might be a lot easier to make those options than to choose a healthy choice or to go out and do some exercise. So it's recognizing that motivation fluctuates. It's not always constant. And then it's having the conversation of, well, what can you do to really remind you about why you're doing this? What is it that's really driving you to do this? Why is it important to you? And how can you really help to keep that at the forefront of your mind? Because it's not something that automatically comes to us as humans. And then it's working with the person to understand, well, how they can remember that. So in the past, I've had people say to me that, you know, their motivations might have been their kids, or their motivations might be, you know, not going down the same path that their parents did. And so I've then asked them, well, what can you do to remind yourself? For some people, it might be putting up a photo somewhere that's going to remind them. For others, it might be, you know, changing their phone screensaver, or writing something down, or telling other people and speaking about it on a regular basis. Others, it's reading or journaling. So for everyone, it's different, but it's really about keeping those motivators at the forefront of their mind and recognizing that it's normal. So if you do find that you sometimes lose motivation, that's okay, and it's important not to beat yourself up about it.
Well, thank you so much, Sarah, and thank you also to Carly, who's been part of tonight's session. I think that I've certainly learnt a lot about health coaching tonight, and hopefully our participants also have. Hopefully they now understand where health coaching fits in the continuum of care, that they're clear on the most appropriate stage of change for a GP to refer a patient for health coaching, understand what the benefits of health coaching are in improving a patient's health and can explain those benefits to their patients, and lastly are clear on and know what the pathway is to refer patients to existing New South Wales health services such as the Get Healthy service. So thanks very much to both of you for tonight.
Thank you. Thanks for having us.
That's great. And I just also want to say a big thank you again to Jeannie, Sarah and Carly for joining us, and also to everybody online. We really hope you enjoyed the session, and we hope you enjoy the rest of your evening.